Did you know the most cardiac deaths occur on December 25th, Christmas, than any other day in the United States? This is followed by December 26th and January 1st. So why is this, and how can we keep our heart happy and healthy during this holiday season? That's what we'll be discussing today during today's live talk. I am going to invite our speakers. My name is Davis from Cardiovisual. Our goal is to help you better educate your patients through our educational videos. You can find our whole library of content at heart.medicalvisual.com and diabetes.medicalvisual.com. We are super excited for our talk today, Your Heart and the Holidays, and I'm just going to go ahead and invite our speakers. As a note, they cannot provide medical advice. That is best done from your healthcare team, but they can provide general insights and tips for staying heart healthy during this holiday season. To start, we have our moderator, who is Dr. Sush Prusty, an ER physician with over 20 years of experience. He is a great collaborator with us at Cardiovisual and does some great ECG educational content on his Instagram. Hello, Sush.
Hello, Davis. Good morning. How are you doing today?
Doing well. How are you?
Just fine, thanks. Beautiful day here in Boston.
Great. It's a little gloomy over here, but glad it's sunny over there. And then we have our guest, Dr. Aseem Desai, who is a cardiac electrophysiologist, also with over 20 years of experience, who has a book, Restart Your Heart, the playbook for thriving with AFib, and focuses on the connection between the heart and the mind. So we're really excited to hear his insights today. How are you, Dr. Desai?
Good morning, Davis. How are you? Great to be here. Good morning, Sush.
Good morning, Aseem. How are you doing today?
Good, thank you.
Good.
Great. Well, I'm looking forward to the discussion. I'm going to leave you guys to it. And yeah, we'll see you at the end of the talk.
Thank you.
All right. Thank you so much, Davis. Dr. Desai, good morning to you. I know it's an early morning for you out in California, so I appreciate you taking the time to join us. It's been a while since you and I spoke, right? So how you doing?
I'm good. I'm good, thanks. Yeah, today is an office day, so it's an early day, but it's not too bad. Usually I'm doing surgery a couple times a week. I'm doing well though. How about yourself?
Very good. Today's my office day at home, so it's a good remote day for me. It's a little bit cloudy, cool, but it's a good day for that. So let's get right to it, guys. This is Dr. Aseem Desai, and joining me. You know, the holidays are a joyous time, Aseem. You know, we all enjoy it. It can also be a tough time for people, for families, friends getting together after periods of, not seeing each other. What are some of the risk factors, specifically the cardiovascular risk factors you see in patients presenting around this time of the year?
Yeah, it's a great question. And I think, we're so used to associating the holidays with joy. And while there is a lot of joy, I think we need to first of all remember that it can be a tough time for a lot of people. People who have lost loved ones. For example, my dad died around the holidays. So that's always a little bit of a reminder, kind of a mixed, bittersweet kind of feeling. I think that many people feel a sense of isolation, especially if they don't have anyone in their life that they're spending time with. Or in some cases, people have very difficult family dynamics, for example. So it actually elevates the level of stress. So I think you got to look sort of, first of all, at like kind of the individual situation and the environment that people are in. I think that if you look at people with heart disease and people without heart disease, so people with heart disease who have high blood pressure, congestive heart failure, coronary artery disease, the levels of physical and emotional and mental stress go up significantly during the holidays, and there's different reasons for that we can touch upon. And then there's, of course, the dietary piece that many of us are invited to parties or having parties at our own home. And so there's a lot of consumption of foods that we're normally not used to eating. And so you'll see higher consumptions of sugars and fats and certainly alcohol, which we can touch upon, and caffeine. And then I think one big part that we kind of underappreciate is sleep. So there's quite a bit of sleep disruption during the holidays,
Yeah.
with going to parties or travel in particular. I think many of us who are really into our daily routines, whether it's exercise, whether it's meditation, et cetera, or spiritual reading, that tends to get disrupted during the holidays. And so, unless you're really, really mindful about it or going into the holidays with a specific strategy of like, okay, this is how I'm going to remain consistent, it can be very easy to have your time get away from you. And I think many of us feel this sense that we sort of lose our time to ourselves. There's not a lot of time for self-care because you're invited to all these different things, and then you always feel bad if you turn down invitations. So like this sort of temptation to want to say no. So it's a tough place for a lot of people.
Yeah, it's a tough place, and it's a disruption, right, in your daily routine, your lifestyle, your exercise pattern. It's such an important thing, and when you put this break, this great break, in your year, it also disrupts your lifestyle, and that's something that people just tend to oversee. And I will mention that this is a tough time. Not to mention what's the terrible tragedy in Wisconsin. So
Hmm.
I just want to make sure that people understand that we are very, very concerned, and our hearts out with the families of those who have suffered from this. Aseem, the big the big medical thing we talk about during this time is holiday heart syndrome. Could you do us a favor for our audience and just break it down into plain language? What is holiday heart syndrome?
Yeah, so holiday heart syndrome really primarily refers to acute alcohol consumption in high amounts that trigger cardiac arrhythmias, most commonly atrial fibrillation. I mean, that's kind of the term was originally coined back in the late 70s,
Mm-hmm.
1978. And
Mm-hmm.
so what it's really referring to, if we just break it down in terms of the effect of alcohol on AFib. So binge drinking is actually considered only a few drinks, like 4 or 5 drinks within like a 5 hour time period. So it's not as much as you sort of think, as that would be called binge drinking. But binge drinking is kind of the classic scenario where either if someone's not used to drinking alcohol, or even if someone is used to drinking alcohol, that acute consumption affects the body on several levels. So alcohol has an acute toxicity on the heart, on the cardiac myocytes. There's actually changes, electrically speaking, in the action potential duration, which is the duration of time that the heart, the electrical activity goes through depolarization, in contraction, as well as repolarization and recovery. So there's shortening of the action potential duration that's seen. There's shortening of the effective refractory period, or ERP. That's the recovery time for the cells in the electrical system. And so that facilitates premature beats, that facilitates what we call reentry, which is short circuits in the heart that can trigger cardiac arrhythmias like atrial fibrillation. So you have that acute effect of alcohol directly on the myocytes, and then you have the impact on electrolytes. So you have drops in potassium, magnesium levels, which increase the electrical instability of the heart's electrical system, triggering cardiac arrhythmias. You have the impact of alcohol as a diuretic. So alcohol predisposes you to dehydration, and we have a tendency not to consume as much water during the holidays because you're so focused on running around and doing all these different things. And so you have this double whammy of dehydration. And so that dehydration actually causes an increase in contractility in the ventricles, but then the atria actually tend to dilate rather than shrink. And you actually have something called hyperosmolarity, where you have an increase in serum sodium, which pulls water from the tissue into, in particular, the atria. So you have atrial stretch. And so you have these different components. And then, of course, people who have any kind of heart disease, notably high blood pressure, alcohol will drive the level
Mm.
of blood pressure up. And so
Right.
that will cause stretching of the atria and triggering atrial fibrillation. Alcohol also, if you have sleep apnea, will worsen sleep apnea in apneic periods. And we know the connection between sleep apnea and atrial fibrillation. And so the classic scenario for holiday heart is the triggering of an episode of atrial fibrillation after consumption of alcohol. And I will say, in electrophysiology practice, you don't have to necessarily see the triggering AFib that night. In fact, it's often 24 hours later that people show up with AFib. And I think that's a little bit of an important point to make to the audience, is that it's not necessarily sort of time related that within a few hours of consuming alcohol, you're going to go into AFib. And people may be lulled into a sense of security thinking, okay, I had a rough
They made it,
night,
right.
et cetera, et cetera. But it's actually like 24 hours later. So that's why we strongly advise people, if you are going to drink in moderation, hydrate a lot before and after drinking. And ideally, I think one of the things that happens with alcohol is oftentimes people go into drinking hypoglycemic or with low blood sugar.
Mm-hmm.
And because alcohol has sugar in it, you sort of seek out alcohol as a way to restore that blood sugar. So it's important to really try to eat before drinking. That will help reduce your consumption of alcohol.
Right. This you're so right. And, 4 to 5 drinks in 4 to 5 hours, that's like one drink an
Yeah.
hour, right? So people, we don't realize how toxic that can be at those levels. It's really, I think, quite surprising to most people. So besides alcohol, what are some of the foods that you see as being real culprit foods? And I'll tell you, I had a patient who came in saying she was in Florida CHF and she came to the ER and she's like, Doc, she was barely talking. So I'm doing all the right things. My cardiologist told me to eat vegetables. I've been eating vegetables. And we said, oh, well, what are you having? And she said, well, she had 6 cans of Campbell's tomato
Mhm.
soup for lunch that day through the
Mhm.
day. So, what are some of the triggers, the foods you think that really put people over the edge?
Yeah, I mean, salt is obviously the biggest one. I think really people underappreciate the acute impact of salt on blood pressure. Like,
Mm,
you can eat a bag of potato chips, and within a few hours, your salt levels will skyrocket. I mean, it's not like getting a bag of normal saline, except probably more salt than even normal saline. And so I think that salt is hidden everywhere, as you know. Salt is very classically found in soups, in salad dressing. So any dressings, and we know around the
mhm,
holidays between Thanksgiving and around the Christmas time holiday, yeah, you see a lot of dressings and a lot of different types of seasonings that are used, and salt is usually a big part of it. And I will say, kind of as an overshadowing of this whole conversation today, it's easy to sit on this Instagram live and say, don't eat salty food, don't drink alcohol, et cetera, et cetera. But we have to be realistic. You have to meet people where they're at. And so when I have conversations with people, it's not you can't approach it from a scarcity mindset of, I can't have this, I can't have that. It's about, yes, you can have these things, and there's ways in which you can moderate your
mhm,
consumption of them. But I will say that probably the biggest thing is that salt intake in food, and then of course the sugar piece. The sugar is present, of course, in a lot of the desserts, and not only in diabetics, but in other people, in regular people. If you have acute rises in blood sugar, you can get like a reactive hypoglycemia and a drop in your blood sugar, which then promotes more eating. And
right.
also, the other piece on the food part is that these very large, fatty, oily, greasy meals can act as stimuli for cardiac arrhythmias through the vagus nerve. So the vagus nerve is the part of the parasympathetic nervous system, the counterbalance to your fight or flight response to your sympathetic nervous system. And we now know that the vagus nerve is actually intimately involved in triggering cardiac arrhythmias. And so that's another thing to keep in mind for people, is it's not just the constituents of the food, the
Mm,
salt, the sugar, et
mm.
cetera, but it's also the size of the meals.
That's really something else. So, alcohol, dehydration, salt, sugar, and vagus nerve stimulation by fatty boluses of food. That's incredible. And that's what we all do during the vacation,
Yeah,
during the holidays. That's all. That's
yeah,
the food we eat,
yeah.
quite frankly. And, I want to touch on something you said. You mentioned mindset. Now, I know that you're a huge proponent of heart health, the mindset, the mental connection between well-being and heart disease. Can you touch on that a little bit and specifically go into the concept of how these wearable technologies can help modify and modulate those things to improve or to prevent these conditions from coming up?
Yeah, absolutely. So, I will say that my first kind of observation of that heart-mind connection happened with my arrhythmia patients. So, and you being an ER physician, I think you can appreciate this, that people will go into atrial fibrillation at home, and then they will go to the emergency room and they'll convert to sinus rhythm while sitting in the emergency room waiting room. Or you're getting ready to shock someone, you're getting ready to do a cardioversion, and they spontaneously convert to sinus. Now, there's lots of different theories behind that, but I've seen it also in regards to people who are having an ablation done, whether it's for AFib or whether it's for premature ventricular beats or whatever arrhythmia it is, that people they stop having their arrhythmias a few days before the ablation. So my theory in all of this is that there's a level of safety and there's a level of comfort people have that they're seeking care. So whether it's in an emergency room, whether it's they're about to get cardioverted or whatever, that their adrenaline levels come down, their cortisol levels come down, their level of emotional and mental stress comes down. Because
Mm,
even though, yes, they're going into a hospital, so you think that would stress people out, they're actually going to a place of safety. They're doing something. There's movement. They're not just sitting at home in this rapid chaotic rhythm. And so I really do strongly believe that there is an impact of the mind in that regard, on the body and on the heart. And we know that, whether it's the hypothalamic pituitary axis, or whether it's the renin-angiotensin system, whether it's the sympathetic parasympathetic system, all these different versions of our stress response, these different components of our stress response, there's direct cardiovascular effects. There's a drug called isoproterenol or Isopro, which is a beta 2 agonist that increases heart rate and contractility. We give that drug during catheter ablation procedures to stimulate cardiac arrhythmias.
Mhm.
And that's basically created by your own body in the circulation when you're undergoing a stress response in the form of norepinephrine, for example.
Mhm.
And so I think that from the standpoint of the cardiovascular impact of what happens in mental health. Now, it works both ways. So people who have, for example, bypass surgery or who have had a heart attack can undergo major depression. I noticed that I found that in my father. So firsthand, that my dad had a heart attack when he was 37 and I was 3. And like he spent the vast majority of his life in sort of this feeling of being brittle, like he wouldn't, want to play sports, or he wouldn't want to go out to eat, or when we would go out and have pizza, he would take the cheese off. So he was an oncologist, so he was, very intelligent about the human body. But I think in many regards, he just felt very, very crippled by heart disease. So you see this bidirectional communication
Mhm.
between heart and mind, whether you have mental health issues that can trigger cardiovascular issues, or cardiovascular issues that can trigger mental health issues. You see this bidirectional communication. And, with regards to the wearables, I think, one of the real areas of fascination in using these wearables is heart rate variability, or HRV. So HRV, heart rate variability, our pulse rate is not fixed. It's not 60 beats a minute. There's a variation that has to do with the interplay between the sympathetic nervous system and the parasympathetic nervous system. And your parasympathetic actually has more of an impact on this variation in the heartbeat. So traditionally, and this is a area that people look at quite a bit in sports and in athletes, that a low HRV implies that you have an overactive sympathetic nervous system and an underactive parasympathetic nervous system, and you're in a state of stress. So you can see that with emotional stress, physical stress, mental stress. A high HRV means you have quite a bit of fluctuation in your beat to beat variation of heartbeat. And that strongly suggests that you have a very conditioned heart, a very conditioned stress response, that your parasympathetic nervous system is active. And so one thing that people can look at with these HRV measurements, and one of the challenges is that we don't have a lot of great validation data that says, okay, if your HRV goes from 10 milliseconds to 20 milliseconds, like what does that mean? So I have patients that come into my office showing me their Apple Watch tracings of HRV. We do have this. So in our heart failure population, for example, they have implantable devices like defibrillators, and those can actually measure HRV. And what we do know about HRV is that HRV drops right before someone gets hospitalized for congestive heart failure, because oftentimes they're retaining fluid, they're going into pulmonary edema, and their sympathetic nervous system is activated, their parasympathetic nervous system is reduced. So the HRV, I would encourage people, if they're going to look at it, don't look at like exact numbers, but it's helpful to look at trends, and tie those trends to what you may be feeling. So if you feel more stressed and you see your HRV drop, that could be a sign that you're less resilient, for example. I think for me, like I think you and I talked the other day. Like I'm a watch guy, and so I don't like wearing an Apple Watch for that reason. I like to wear the watch my wife gave me for our anniversary, and so I wear an Aura ring, for example. So the Aura ring is nice because it'll track sleep is one of its primary purposes. That's why I got it, because I was having some sleep disruption. But one of those things that it tracks is your HRV, and one of the things I like about a lot of these wearables is that they have AI algorithms built in, that if it sees biometric changes, like if it sees changes in your REM sleep, or say it sees changes in the amount of awake time you have, then it'll ask you several questions. It'll say, hey, did you eat a late meal? Hey, did you have alcohol? Hey, could you have been dehydrated? Then it'll give you advice on what to do. And
Right.
so I think that's really where I think the wearable technology is helpful, is that it makes people more mindful. But I would caution people, it's very easy to get obsessed about these numbers. Our engineer patients in particular are really good at this. They'll create these elaborate graphs of like what's happening to their numbers. And there's nothing wrong with that, but I think you
Yeah.
kind of lose sight of the big picture. Like, so you always want to be thinking about, okay, there's this data that you're getting, but how do you connect that data with how you're feeling? And most importantly, is how do you actually make an actionable change in your behavior? And I think that's where, using the wearable technology can be very helpful. And then in particular, like with Apple, people can record their EKGs if they're having palpitations. They can. One last thing, actually, in thinking about palpitations, is that a lot of times when people have panic attacks, they can feel like their heart's racing, and it doesn't necessarily mean they're having a cardiac issue, but they could be. So,
Yeah, it's so true. When I wake up in the morning, and I've got one of these things too, the Oura rings, and I look at the HRV, and it's very easy to get hyper focused on
mhm.
minutia like that, and much more difficult to just kind of step back and say, okay, so what does it all mean, and what's the long term, the long road here, and how does that affect? How am I going to change that? So fascinating things. I think that the technologies are such that they're really dramatically improving, I think, changing our lives and the way we see our own health. So, and speaking of that, let's talk about our families and
Mhm.
friends. You and I are physicians, and we go to, our homes, our families, and for others also, what kinds of things should people, our audience, look for in their families to make them more aware of and some sort of an impending problem in them, in their families?
Yeah, I think that, it's very common for people if they're having a medical issue to not want to seek emergency
Yeah,
care around
yeah,
the holidays because, who wants to go to an emergency room? You're in a party, you want to spend time with people. So I think people just getting very comfortable, we have this expression in medicine, how does someone eyeball, when you look at them, how do they look? Like, something bad is going on. So I
right.
just encourage people to be kind of mindful that if you have a loved one and they suddenly look really, really pale and they're not feeling good, but they're saying they're okay, you really need to press them. And it's better to have someone get angry with you transiently than to have them drop dead. And so that's where I would say, in particular, it's not always the classic chest pain, shortness of breath, radiating to the jaw. Women in particular, diabetics, older patients can have very atypical symptoms for acute coronary syndromes. They can just feel nauseous. And the problem there is that you just eat a big holiday meal and you're nauseous. So you think it's indigestion, but it could be a heart attack. And so you don't want people to overly panic, but at the same time, so you want to kind of just be more mindful of, your family member doesn't look quite right. And then you think about your family member and the risk factors. So if your family member has obesity and diabetes and high blood pressure, and then they're not feeling good, that's something to be mindful of. The other thing is that you kind of hear about classically in cold climates, people are out there shoveling the snow and then they have a heart attack. And there's a lot of different reasons why that happens, but that's also something to be aware of, is especially in your older family members, to really kind of caution people to pace their activity because, people are like trying to get on top of their roofs and hang lights and all these kinds of
Sure.
things. And, I think it's hard. It's hard when, especially it's older relatives, or like I know my mom in particular was really hard to kind of, give any feedback on. She kind of wanted to do her own thing. But I think people just, it does take a little bit of speaking up. But I think that you're going to do your family a service by catching a problem before it becomes a bigger issue. So I think just getting comfortable with, like, eyeballing people, seeing that something doesn't seem quite right, asking people how they're feeling. And then I think, we have such black and white thinking about things in general, about our health. So if someone doesn't want to go to the emergency room, hey, maybe they'll go to an urgent care. Okay. Like, so, try to meet people a little bit in between. It's very easy for people to forget taking their meds. It's very easy, especially when they're traveling. So I think just these small little things like having a medicine pill case or putting alarms into your phone, I think those kinds of things can make, really big
Yeah.
difference. Most important thing, I think, going into the holidays is strategy. Have a strategy for how you're going to kind of survive the holidays. And probably the number one thing that you have the most control over is your time in the morning. Like, that's one thing you can control. When you wake up and spending a few minutes just kind of grounding yourself, meditating, having a good set for the day, because the rest of the day can get away from you. You can get pulled in a variety of different standpoints. But even when you're traveling, you do have control over when you get up in the morning. And it only takes a few minutes a day. But having that morning routine established as you head into the holidays is going to help quite a bit.
Yeah, yeah. Thanks so much. All true and very, very important stuff for people to take away. Aseem, I wanted to share this book with our audience. This is a book, I bought this, Restart Your Heart, the playbook for thriving with AFib. It's a great book. I've shared this book with my colleagues, friends, and patients. What inspired you to write this book?
Yeah, it's thank you. It was a guy that I was walking out of the EP clinic one day, and he was told by several different physicians, including cardiologists, that nothing could be done about his AFib. He just had to live with
Mm,
it. And that's simply not true. Now, there are patients that we cannot convert to sinus rhythm because they've been in AFib too long, but we're seeing more and more nowadays that we're successful in getting people into sinus rhythm. And a lot of that has been through the technology of ablation and more recently pulse field ablation, which is an incredible technology, game-changing technology. But the reason why I wrote the book was people were being told a lot of misinformation. And then I did a search on Amazon, and like there was really very little written by electrophysiologists, and we specialize in AFib. So I said, let me write something for people that they can read when they get diagnosed or a family member gets diagnosed, and kind of take them through a holistic approach to it. So I don't just talk about technologies and drugs and ablation. I actually spend a lot of the book talking about what are things you can do in your lifestyle, what are things you can do with your diet. I talk quite a bit about the heart-mind connection and the importance of stress management. And really what inspired me to write a lot of this stuff too was my own, personal issues with my family, that my dad died of sudden cardiac death when I was in med school. My mom had a cardiac arrest, and I had to take her off a ventilator. And so I've had my own mental health challenges with depression and burnout. So I've kind of been all three parts of the healthcare system.
mhm.
I've been physician, family member, and patient. And so I tried to approach the book in writing it from that standpoint. And I wrote the idea, the subtitle is Playbook, because I wanted people to have something easy to go to, kind of the A to Z. You get diagnosed with X condition, this is what you do, rather than going to Google or trying to figure out with ChatGPT, like all these different things to do. Write something from, someone who's credible, who deals with this every day. And that was kind of my goal with that book. And now my next project is kind of working on the mind, because we talked about the heart mind connection. So that's kind of the route I'm going in terms of the next things that I'm writing about.
Yeah, it really is a great book, and you've got a checklist there for folks to kind of follow it. I love that. I've actually photocopied, parts of that for my patients. So thanks so much for writing that, and really I want to hear about the next book you're doing when you do write it and finish it probably next year. I'm
Yeah.
guessing, right?
Yeah.
It's gonna be great. Hey, listen, a couple questions came up here. I wanted to make sure that we kind of just touched on. One was a question that came up was, once you're diagnosed with AFib, is that a chronic thing? In other words, can you expect to have it recur, or can you just have a one and done AFib, you're cured? What's the, in broad strokes, what's the answer?
Yeah, so the thing about AFib is it's a progressive disease. So every episode of AFib that you have creates a muscle memory to have more AFib. So the whole theme nowadays is early detection, early intervention. So you want to jump on it right away. So if you look at someone's first time episode of AFib, if they have no other risk factors, no obesity, no high blood pressure, any other factors, it's what we call lone AFib, then there's about a 50% chance that they're not going to have another episode, especially if they adhere to lifestyle changes, in particular avoiding alcohol, because it's such a trigger, even small amounts of alcohol, not just holiday heart. But if you look at people who have all the different risk factors, if they're out of control, if there's obesity, if there's out of control diabetes or blood pressure, the AFib is simply a symptom of a body out of balance, and that AFib will come back. So it's almost important to really think about AFib as not just this electrical disease of the heart that we ablate and say, see you later. It's like you got to treat the whole body, whole mind body, in order to prevent that condition from recurring. And so we don't like to use the word cure when we're talking about AFib, only because 1 in 4 of us over age 40 at some point in our life are going to get AFib, because the number one risk factor for AFib is aging, that you get fibrosis in your heart, and that creates the short circuits for AFib. But that being said, if someone has a single episode of AFib that was triggered by something like high amounts of alcohol, and then they avoid that, then there's a much lower chance of
Mhm.
having AFib in the future. I will say one thing, there is something called silent AFib. That's why things like the Apple Watch are helpful. We have implantable devices that we use. So people can have AFib that they don't realize. Sleep apnea is a huge cause of AFib, and especially in people who have no other reason to have AFib, we have a very low threshold to check a sleep study, because you don't just have to have a big neck or have obesity to have sleep apnea. apnea. You can have central sleep apnea. There's a lot of different forms of sleep apnea. And so I would encourage people to just kind of be thinking about if they get diagnosed with AFib, what are the ways in which they can prevent recurrences in terms of lifestyle, in terms of modification of risk factors. And with ablation technology, we have a lot of days we are seeing, again, we don't like to use the word cure, but let's just say in remission. It's probably a better way of thinking about it, that we see much fewer episodes of recurrence of AFib in those kind of cases if you intervene early.
Right. Yeah, great advice. I think, people talk about this stuff all the time. I still get asked a question about, the French paradox. Isn't a little bit of wine good for you? And, as you mentioned this before, alcohol is a toxic substance to the heart, period. I don't think there's much more to say about that. There's no real beneficial effects, different types of grapes and to not grape, it's all been disproven, I think, pretty much, right? So, yeah, and it's all a matter of, you got to live your life too.
Yeah.
And so things in moderation maybe, and not overdoing things. There's some great comments here, by the way, saying monitor your intake. Somebody said it is such an important thing, just to kind of be mindful of what you're consuming, and not just binging with alcohol or food or fatty stuff. So great comment. There's some great comments here, by the way, that we cannot get to all here, but we'll try to get to your questions and answers in a later post. Dr. Desai, we're actually winding down here. It's coming up on 30 minutes. And I want to thank you so much for taking the time today to speak with us about not just holiday heart syndrome, but how we can manage our own heart health through these holidays. So Aseem, thank you so much. Happy holidays to you, my friend. And Davis, I'm going to turn it back to you.
Thank you.
Yes. Thank you both for this discussion. I think it's great for people to know to go into the holidays to make sure that their heart is happy and healthy, and as well as their friends, family, patients, whomever, making sure we all have a good holiday. Well, with that, I wish everyone who's here right now a happy holiday, and thank you guys again for speaking with us today.
Great.
Thank you.
Thank you. Thanks, Aseem.
All right.
Thanks.
Have a nice day.
You too.